Order. Ms Patten has the call for a question.
Thanks, President. My question is for the Minister for Health and relates to gambling harm. I refer the Minister to the Victorian Public Health and Wellbeing Plan 2019 to 2023. In Victoria, the Public Health and Wellbeing Act 2008 imposes a responsibility on state and local governments to plan for, protect and improve health and wellbeing, which is reflected in that health and wellbeing plan. Except for the cursory and only mention under improving mental wellbeing, gambling harm is not considered in the plan, despite the Victorian Responsible Gambling Foundation estimating that gambling accounts for 22% of Victorian mental health sector costs. My question for the Minister is, what is the actual cost of gambling harm to the Victorian health system, both in terms of lives and dollars?
Minister.
Thank you. I thank the member for her question. Obviously, the issue of gambling and gambling harm does sit with the Minister who is responsible for the gambling industry. In terms of a specific quantification around direct links to the health system, I will seek some advice as to whether that has been able to be quantified. I imagine that may be something that may be very difficult to quantify, but I'll seek some advice as to whether that has been undertaken. What I would say also is that the Public Health and Wellbeing Plan is something that's developed every 4 years under a statutory requirement. We did release the latest plan early this year. The 10 priority areas that were identified in that plan related to key areas where preventative action can actually reduce the harm reduce and prevent health harm to Victorians. We have identified those key areas, and they are tackling climate change and its impact on health, reducing injury, preventing all forms of violence, increasing healthy eating, decreasing the risk of drug-resistant infections in the community, improving mental wellbeing, increasing active living, improving sexual and reproductive health, reducing harmful alcohol and drug use, and reducing tobacco-related harm. And as part of those 10 areas, there was 4 areas where they were regarded as priority areas, and they related to issues such as smoking and active living and increasing healthy eating, and also the climate change one. They were the 4 of the 10 that were identified as the priority areas. As part of improving mental wellbeing, that would of course touch upon things such as gambling, but it is a broad umbrella, I guess, in terms of how we improve people's mental wellbeing. And I think it's very timely that you're asking me this question today, as we've just received the interim report of the Mental Health Royal Commission. The government is now considering that report, and I want to take this opportunity to thank Minister Foley for the work that he's done in this area. We know that we have a lot of issues that we need to address in terms of service delivery in mental health. There are Victorians slipping through the cracks now, and it is costing lives, and this is why the Premier's made it very clear that we will work to deliver the recommendations of that report. And of course, we look forward to receiving the final report of the Royal Commission next year.
Ms Patten, supplementary.
Thanks, President, and I thank you for your response, Minister. The Victorian Responsible Gambling Foundation also estimates that people seeking treatment for mental ill health are 8 times more likely to be experiencing high levels of gambling harm. So I think that information is absolutely out there, and you mentioned that mental wellbeing was one of the target areas. So I'm still curious as to why gambling harm wouldn't be included in the Victorian Public Health and Wellbeing Plan.
Minister.
Well, thank you for that further question, Ms Patten. As I've explained, the 10 key areas that have been identified include mental health and wellbeing. It's an important area that we know touches upon so many lives, and this is why, as a government, we have commissioned this really important Royal Commission to guide our way forward here. I'm not seeking in any way to suggest that gambling doesn't cause harm in the community. I absolutely acknowledge that. That's why there are a range of harm reduction, minimisation and support services that exist that sit under Minister Kairou's portfolio. But I'm happy to provide some further advice around those types of supports and programs to the member. And I'll seek some advice from Minister Kairou's about that and the issue that you touched upon in your substantive question. This plan has been developed through extensive consultation with health prevention agencies to really drill down the 10 areas where we can put some concerted effort to reduce poor health outcomes for Victorians. And this is why we're going to focus on mental health as one of those 10 areas.
Thank you.